Many people turn to teeth whitening to get a big, bright smile, but is it right for any age? Maybe not. Channel 3's Sarita Arteaga explains why tonight in Your Health.
Prom season is fast approaching, and while finding the perfect dress or tux is important, teens also take other steps to look good. Among them, teeth whitening. But is it such a good idea at the age of, say, 15 to 18? We asked a dentist and UConn dental school instructor, Dr. Sarita Arteaga.
We try to give an approximate age range in the teens, about 16 to 18 years old.
Dr. Arteaga tells us it's important for children to wait until the inner layer of their teeth, the pulp, is fully developed before entertaining the idea of whitening. And the best way to know that is by talking to the dentist.
They can see from your x-rays where the pulp tissue is, so they can give you some recommendations on whether you'll have a lot of sensitivity. But generally, for my own patients, I would never recommend before puberty.
The way whitening works, the peroxide-based product is applied to the teeth either by the whitening strips you've seen that adhere to the teeth or by putting a peroxide gel in a molded tray that then is put over the teeth. The peroxide goes through the enamel, the hard outer layer of the teeth, and reaches the middle layer or dentin. The whiteners break up stains on both layers and break down the color of the tooth.
You can bleach your teeth to a shade that's lighter, but not necessarily as paper white as you would expect, or coat white, because that's what people come in looking for.
Whitening toothpastes like the ones you see here work a little differently.
Whitening toothpastes are very abrasive, and they work by removing the surface stains on the enamel, so it can be quite effective.
She says whitening toothpastes are a good and safe alternative to whitening treatments for children.
And Dr. Arteaga has one last piece of advice. She says if you're going to whiten, you have to follow the instructions carefully. If you use it for less time each application, or you don't follow the proper amount of days, you could ultimately end up damaging your teeth. And it could cause sensitivity and even dehydration. With Your Health, I'm Irene O'Connor, Channel 3 Eyewitness News.
So that's what Irene was doing in the ladies' room, whitening her teeth.
There you go. And more is not necessarily better. I know some people want to leave those strips on longer than recommended. Not a good idea.
Good advice with that whitening toothpaste, though.
Yes, it is.
Safe way to go.